Thank you very much. And now I would like to invite you to a fascinating journey with me and take you back to the past through my case history. My name is Eva Varga. I was born in Debrecen, Hungary, 1968. I know myself as a Hyper IgE patient since 1995. As my immune deficiency has been identified very late, just at the age of 27, it couldn't prevent me to become a doctor, and thank God I'm able to work as a GP for more than 20 years now. It has been 4 years since I started to work as the secretary of the Hungarian Organization for Patients with Immune Deficiency, and I'm really very enthusiastic about this job. From the beginning of my life, I had to face slight and also very serious health problems. Due to the lack of early diagnosis, several times in my childhood and young years, I was misdiagnosed and treated in the wrong way. That's why I thought it might be interesting for you to show my case history. Hyper IgE syndrome is a rare primary immune deficiency characterized by eczema, recurrent staphylococcus skin abscesses, pneumonia with pneumococcal formation, remarkably high serum IgE levels, eosinophilia, and involvement of skeleton and connective tissue. On this slide, I collected the most important disease manifestations. The disease was first described as Job syndrome by Davis et al. According to the Bible, Satan accused Job of that he follows God just for his own benefit. His body was covered with burning and painful ulcers, but Job stayed hopeful even at tough times. He learned to see the beauty in everything that God created. His attachment to God, his trust didn't come to an end, and with his loyalty, he destroyed Satan's accusations. In 2007, mutations in the signal transducer of activator 3 were shown to be the cause of Hyper IgE syndrome. STAT3 plays a key role in the signal transduction of a broad range of cytokines. It's crucial in the interleukin-6 mediated regulation of Th17 cells, which are procedures of interleukin-17, pro-inflammatory cytokine involved with the host defense of Staphylococcus and Candida. It was identified by Professor Marodi that my defective amino acid sequence on STAT3 is R382W, as it is shown on my family tree. My disease is probably a new mutation, as my parents are healthy. I have got a healthy son, but my daughter is affected. Unfortunately, I've got only a few slides about my disease, but I show you some. Immediately after birth, I had two typical symptoms, newborn rash and hyperflexible joints. I was diagnosed with eczematic dermatitis, and treatment was just some tar ointment. By now, we know that newborn rash is almost always a presenting sign in Hyper IgE syndrome. The dermatitis resembles classic atopic dermatitis, but may have distinctive features. After the newborn period, skin findings also include retroauricular fissures, external otitis, infected dermatitis of axial and groin, folliculitis of upper back and upper back, and mucocutaneous candidiasis, cold abscesses, and in some patients, a pitted scarring of the face. Although my daughter was diagnosed with Hyper IgE syndrome very early, we couldn't avoid the infected dermatitis of her chin, which you can see on the second picture, and it ended in an abscess. This means that Hyper IgE patients need a very aggressive skin care in attention with the usual bacteria and fungi. And now I would like to show you the picture you have already seen, but I highlighted those symptoms which I myself had. During my childhood, I very often suffered from upper respiratory tract infections like otitis media and sinusitis maxillaris. At that time, there wasn't available such a wide range of antibiotics, so the treatment was mostly surgical, I mean the paracentesis of the ear and the lavage of the sinuses. Several times I was treated with pneumonia, and at the age of 7, I was operated on with a large abscess of my left kidney. This was the aftermath of an undiagnosed pyelonephritis xanthogranulomatosa. The correct diagnosis was formed only really very late, only at the operating theater. Nowadays, thanks to the modern imaging diagnostics and a wide range of antibiotics, the diagnosis and treatment of abscesses of internal organs are much easier and safer. In my teenage age, I suffered from different skin infections, onychomycosis, mucocutaneous candidiasis, and deep skin abscesses. Due to lack of external signs of inflammations, surgeons rarely believed that my swelling was an abscess, but time to time Staphylococcus was cultured from the pus, but without antibiotical treatment, these abscesses often returned. A few years ago, at the age of 14, my daughter also had a deep skin abscess in her left axillary region, but being a PIT patient, she got intravenous antibiotics in the meantime of surgical treatment. At the age of 37, I was diagnosed with diffuse large B-cell non-Hodgkin lymphoma. Chemotherapy is a very difficult task to bear, but with an immune deficiency, it's even more challenging. As I had bronchitis or pneumonia after each curing, I felt like a rope dancer, if you understand what I mean. But luckily, by that time, biological therapy, MAPTERA, was available in Hungary, so I managed to overcome the disease. As it is shown in this picture, I tried to collect the most important treatment possibilities in the 70s and nowadays. As my case history shows, the early diagnosis and treatment of infectious complications are essential. Recent studies reveal that immunoglobulin replacement also add to the clinical care in STAT3 deficient Hyper IgE syndrome, and in more severe cases, hematopoietic stem cell transplantation is also an important possibility. Studies reveal that after stem cell transplantation, IgE level remain decreased, but the pulmonary complications like bronchiectasia and pneumothorax still occurred. As it is shown on the diagram of Oland et al., Hyper IgE syndrome is characterized by a wide range of multisystem features. I mean osteopenia, recurrent fractures, dental manifestations, hyperintensity in brain white matter, and high degree of vasculopathy. Therefore, multidisciplinary care of patients would be important, and future studies are also needed to focus on clinical care of these non-immunologic features. And finally, let me talk a few words about prevention according to my own experiences. It's an obvious fact that lifestyle decisively influences health status. During my work as a GP, I'm really exposed to many sources of infections, So drinking my morning coffee with some Ganoderma lucidum, which you can see on the first picture, helps me to struggle with upper respiratory tract infections more easily. For the same reason, I often go to the sauna, which has a good effect on not only my skin, but my circulation and respiratory tract. Because of my scoliosis, I regularly do physiotherapeutic gymnastics. And it's me at the age of 5, seem to be a happy child. With this picture, I would like to thank those who helped me to survive all of my difficulties. First of all, Professor Marodi, who diagnosed my disease, and then Dr. Tamás Schneider, Chief Medical Officer of Hematologic Department of National Oncology Center in Budapest. He helped me to survive a deadly disease. And then I would like to thank all treating physicians and medical advisors. Special thanks to my family. I must thank IPOPI for they gave me the possibility to come here and tell you my story. As a PIT patient and also a physician, I would like to encourage PIT patients to take care of themselves, eat healthy, neglect harmful habits, and pay attention to self-hygienic. But first of all, stay optimistic and positive in mind, just like Job stayed after all his afflictions. I'm happy that according to your conscientious work, more children with primary immunodeficiency have chance to live life to the fullest. Thank you.